Welcome to our video on raising children of parents with SUD. At the end of the video, please complete the post-learning check-in found on the Family Learning Series webpage. This brief check-in will provide feedback to DDAP on the usefulness of this video and offers the opportunity for suggestions on future learning to possibly be developed. Individuals seeking treatment or support for themselves or a loved one can call the toll-free PA Get Help Now helpline at 1-800-662-4357. It's available 24 hours a day, 365 days a year, and staffed by trained professionals. A live chat option is also available online or via text message at 717-216-0905. For those seeking help who may not be comfortable speaking to a helpline operator, remember, you are not alone in this. In this video, we will discuss transitioning a child into your home, using words a child can understand, providing a stable environment, discussing the parent, and genetics in substance use disorder. Now, let's begin. If you are raising someone else's child because of the parent's substance use, you are probably facing a lot of challenges and have a lot of questions. It is vital that you reach out for support from other families who have experienced this situation, or from agencies and programs designed to help kinship caregivers. Don't be afraid to ask for help. A child who comes to you when parents are actively using substances is likely to be a child in crisis. This means that things will probably be rough for a little while. Each child's experience is unique, and there isn't a one-size-fits-all way to cope. Even though your home may be safe and more comfortable than where the child lived before, the child faces a transition and has a very deep sense of loss. Sometimes we assume that teenagers are able to cope better than children, but they need just as much help as their younger siblings. Keep as much of the child's routine the same as possible. If you can avoid changing schools, that creates consistency that helps the child adapt. If they have a special blanket, pillow, or stuffed animal, bring it with them. Try to get their favorite objects or toys into your home. For teens, help them to maintain connection with peers and school activities. Give the child time to settle into your home and, if they don't know you well, have a chance to get to know you. Reassure the child that they are safe and cared for. If you are not sure what the future arrangements will be, don't make promises. Make a commitment to being consistent and involved in the child's life, no matter the circumstances that led to their living with you. Don't expect older kids to automatically adapt to the new environment. They may have been in charge in their parents' home and are reluctant to give that up. It was necessary for the older children to take care of their younger siblings and keep them safe. It might be hard for them to return to the role of being a child or teen themselves. You might explain that taking care of siblings was needed at the time, but now you and other adults can take over, and they can be a kid. Explain substance use disorder to children using words they can understand and encourage them to ask questions. Keep your answers short. Offer the child opportunities to talk about what has happened in the past. You can show your openness to conversation by asking broad questions, not interrupting, and listening when the child talks. Consider seeing a professional counselor or attending a support group for children. Follow the child's lead in deciding when and how much to talk. The same goes for teenagers, who may be reluctant to talk. By showing that you respect their privacy and understand that it may be hard for them to talk, you keep the door open for when they are able to talk with you. Remind children and teens that they are not to blame for what has happened. Many children feel responsible for their parents' behavior, and they need you to tell them they did not cause the parent to have the illness. Give the child words to attach to feelings, and let them know it is okay to have big feelings about the changes in their lives. For example, when a 5-year-old is having a tantrum, instead of just saying, "Stop it, right now," you might try, "You sound like you're feeling pretty angry right now." Repeat it enough. This same 5-year-old might be able to say in the future, "I'm so angry." Instead of throwing another tantrum, Young children may not be verbal, but they show you how they are feeling with their behavior. Encourage the child, whatever their age, to become involved in school, community, or church activities. These can be great outlets for the child's feelings, as well as give them more caring adults in their lives. If they have been involved in these groups while living with parents, try to continue them. Some children have not been to the doctor or dentist while their parents were in a time of active substance use. Make sure they are up to date on checkups and address any unmet needs. Many times, children do not have an opportunity to just be a kid when they are living with a parent who has a substance use disorder. Give the child lots of opportunities to play and have fun, both with friends and family members. Play with the child and enjoy being with them. Often, older children and teens have been taking care of their younger siblings and did not have a chance to have fun while in their parents' care. Ask them to let you take over for a while, so they can relax and be the young people they are. Stability and keeping promises are important to children. This is the way they learn to trust and feel secure. Be extra careful to do what you have promised to do, even if it seems like a minor thing to you. Praise good behavior. Any type of good behavior, following rules, playing well, sharing, helping, should be acknowledged. Although it may sound like common sense, most of us do just the opposite. We don't want to rock the boat when things are going well, but we speak up when things go badly. At first, you may have to look hard for things to praise, but notice effort as well as accomplishment. Teach the child ways to calm down, cope, and express themselves when feelings become overwhelming. This could be things like deep breathing techniques, mindfulness exercises, yoga, walking in nature, journaling, or arts and crafts. Remind children and teens of these methods when they are feeling overwhelmed, anxious, or sad. Be a good role model by expressing your feelings appropriately and practicing self-care. Avoid shaming the child's parents, and don't add to the embarrassment that children often feel when their parents use drugs or alcohol. Stay calm and positive and build the child's hope and optimistic attitude. Teens may be especially sensitive to embarrassment and feeling different from their peers. Be patient. New habits and behaviors don't appear overnight, but they can be learned. Anticipate that behavior changes will take place over several months, rather than just a few days or weeks. Understand that sometimes a child may not have learned things that seem normal for a child of this age to know, and they may need your help. Regularly reassure children, no matter their age, that you love them and will protect them, and that you will not abandon them. Children often feel isolated and alone when there is substance use in the home. Remind them that they are not alone, and that there are other people who care for them and will help them. Celebrate holidays and special occasions, and plan for the difficult feelings children may have if a parent cannot be present for a birthday, graduation, or milestone event. Discuss options and help them manage disappointment and questions from others. For example, you may buy the child a toy or game that they have been asking for, and you are looking forward to seeing how excited they are to receive it. When the time comes, the child may not respond in the way you expect, and may appear disinterested and ungrateful. One reason might be that they are wishing they could play with the game or toy with their parent as they did in the past, and they may be remembering previous holidays. Pay attention to your own needs and take care of yourself. You may have strong feelings toward the child's parents or the extended family. Don't let your desire to blame or find fault get in the way of caring for the child. If a child's parent is absent, talking down about the parent will probably have a negative impact on your relationship with the child. Children love their parents. It's important to separate the illness from the individual. Not only will this help you maintain a healthy relationship with the child, it also models how to communicate feelings. Talk about the parents with understanding and compassion. They are people who have an illness, not bad people. Avoid pressuring the children to take sides in conflicts you may have with their parent. Older children may come to the defense of their parents, and this creates an unnecessary power struggle. Don't use the child's statements and opinions to get back at the person with a substance use disorder. Don't assume that the child will be harmed by seeing their parent. If it is safe to do so, allow the child to stay connected with their parent. This might be a video call, phone conversation, or a short visit, but it can often be helpful in maintaining the bond between parent and child. A therapist or counselor can help you decide if this is a good idea. Because there is a genetic component to substance use disorder, it is important to discuss risk with the teens in your care. You may need to explain this concept a little. Risk means that something is more likely to happen, but not that it will happen. With this understanding, frame the discussion about prevention and risk factors. Genetics are a significant risk factor for SUD, but risk factors are not destiny. Not everyone who has a family history of substance use disorder will develop the illness. Preteens and adolescents should be told that substance abuse often runs in families, and that if they do drink or use drugs, they stand a greater chance of developing a problem than someone who does not come from the same kind of family background. Explain to them that the safest choice for them is to not use drugs at all. When parents receive treatment and begin to recover, it is important to encourage and support the parent, while you maintain healthy boundaries and engage in family recovery. Learn as much as you can about the process of recovery and how you can help. Be realistic while giving the child a chance to hope that their parent's recovery will continue. Saying something like, "Sometimes it seems like things are uncertain, and you're worried that Dad might go back to what he was doing in the past. But for right now, he is doing what he needs to do, and he wants to be healthy." When you see the parent engaging in recovery, let the child know and share your hope with them. Taking care of a child or teenager. Whether it's your grandchild, a relative's child, or a foster child who has experienced the trauma and loss associated with parental substance use, is really a labor of love. There will be times of sadness and times of hope. You are providing a child with love and security while their parent is unable to do so. This can be a real challenge for you, as you thought your days of everyday parenting were behind you, and you may be feeling the loss of some of your own freedom. It's normal to be stressed out by the situation. Reach out for help and support, and keep up the good work. Remember to reach out for support when transitioning a child of a substance use disorder parent into your home, as it can be challenging for both you and the child. Using age-appropriate language is important to help children understand and make sense of what is happening in their life. Being active keeps their mind distracted from the things that are happening around them. Being involved in sports, clubs, or other social activities can introduce the child to more caring adults. Avoid bad-mouthing their parent regardless of how you may feel. Remember that although the child's parent is battling SUD, it is important that you help the child maintain healthy communication while setting appropriate boundaries. Thank you for watching DDAP's video on raising children of parents with SUD. Please complete our quick post-learning check-in so we know how beneficial this was for you and to offer any suggestions you may have for other videos you would like to see. Don't forget, you are not alone.